It's already late. Where's Arjun?
He's looking for universities, right? Maybe he's held up there.
You look so tense. By the way, did you get to choose the university?
No, I'm unable to find a university that meets my requirements.
Whoa. Meet your requirements? What exactly are you looking for?
I'm looking for a place that gives me an opportunity to grow, to excel, to invent, and to innovate. I want to be a part of an institution that paves my way to discover myself and to witness the world moving forward in technology. I want to go to a place that sets a futuristic pattern of education filled with ideas and radical performances. Basically, I want to live my dream.
Dayanand Sagar University. Live the dream.
So we're good to go live.
Yes, sir.
A very good morning to all of you. Let me thank all the students, the prospective students from the second PU science streams who have from their, I would use the word busy schedule, because exams are over, results are coming out, which college, which university, which city, which place, all these tensions in their mind. But with all these tensions being there, they are still a part of today's webinar, which has a very unique topic: careers in physiotherapy. Physiotherapy candidates have a very good career option in India or even abroad. Healthcare and its technology upgrade, often they need specialized profession in most of the health category, and physio is one of them. It's a sunrise for the unexplored medical science of physiotherapy. There's a great and rising demand for physiotherapists with all kinds of patients, including those recovering from surgery and accidents, and those suffering from chronic diseases like arthritis needing their services. Physiotherapists are always in demand, and hence, for students who are confused, who have not made up their mind, who are sure to get into the medical industry, this webinar is for you. Before we go on to the speakers, I would like to take the opportunity of welcoming our distinguished speakers for today's webinar. I start by introducing our Honorable Vice Chancellor, Dr. K.N.B. Murthy sir. Sir is the Professor for Computer Science Engineering and Vice Chancellor at Dayanand Sagar University, Bangalore. Sir is also the former Vice Chancellor at PES University, Bangalore. Sir holds a bachelor's degree in electrical power engineering, a master's degree in electrical engineering from Indian Institute of Science, Bangalore, and a PhD in computer science and engineering from Indian Institute of Technology, Madras. Sir has worked as a research specialist in parallel computing at New Mexico State University, US. Sir is currently the member of Karnataka State Higher Education Council and the Academic Senate member at IIIT Dharwad. Sir, a warm welcome to you.
Thank you, Shinde. Thank you.
Our speaker number 2 for the day is the Dean, Dr. Pushpa Sarkar. She currently working as the Dean for Allied Health Sciences and School of Health Sciences at Dayanand Sagar University. She has worked as a director at Rajiv Gandhi University of Health Sciences. She is the board member of various reputed institutions of Karnataka and also a visiting faculty of for various medical colleges of Karnataka. She will be touching upon the topic today, physiotherapy and its role in healthcare profession. A warm welcome to you, ma'am.
Thank you, Mr. Shinde.
Our speaker number 3 for the day is a veteran from the industry, Dr. Mohanna Krishnan, a senior physiotherapist at Jaipur, at JIPMER Hospital at Pondicherry, a master's degree in physiotherapy in 2009 and has been a top ranker, has done certification in orthopedics and manual physical therapy which is also called as the short form of COMPT, and a diploma in yogic education and PhD in 2016. He currently works at the Department of Orthopedics, Jawaharlal Institute of Postgraduate Medical Education and Research since 25 years. Dr. Moana Krishnan does research in physiotherapy, current project in conservative ACL rehabilitation. PMRC was invited as an external examiner by University of Rwanda, Central Africa. He has over 36 publications which are published in national and international levels, and also a visiting professor for various top universities, not only in India, but also abroad. Dr. Moana Krishnan will be touching upon the topic of physiotherapy as a profession, its uniqueness, scope, and future. A warm welcome to you, Dr. Moana. Our speaker number 4 for the day is Professor Dr. M. Vijay Kumar. Sir is the principal for College of Physiotherapy at Dayanand Sagar University. Has been a professor for sports physiotherapy and rehabilitation. Master of Sports Physiotherapy he has completed in November 2000 with a fellowship diploma in sports rehabilitation from London Academy of Sports and Health Science. A PG diploma in on-field sports injury management. A PG diploma in fitness and wellness management. International certification in bioethics and human rights by UNESCO, and presently a PhD scholar under D.Y. Patil Vidyapeeth, Pune, with 20 years of teaching and clinical training experience with keen interest in research. Have 32 publications on international journals with 5 ISBN numbered books, associated with more than 10 universities for various official works. Got several awards for teaching, research, and sports. Dr. Vijay Kumar will be touching upon the topic the physiotherapy program at DSU, its merits. A warm welcome to you, Dr. Vijay Kumar.
Thank you, sir.
And we are so glad to have one of our alumni students, Mr. Abdullah. He's an alumni of the DSU. He has completed his BPT program from DSU in 2022, and he is from Nigeria, and he will be sharing his experience. A very warm welcome to you, Mr. Abdul.
Thank you, sir.
I now take the opportunity of inviting our Honorable Vice Chancellor, sir, to set the context and to share their views. Over to you, sir.
Thank you, Shinde. Good morning, my co-panelists, particularly our distinguished alumni who is present in this panel. Also the aspirants and the parents and invitees and the organizing team. I'm extremely happy to be a part of this campus info session. As you're aware, Dayanand Sagar University offers programs in various schools of study. Physiotherapy comes under allied health sciences. The objective of this campus info sessions is to provide information about each program of study in respect of the opportunities, in respect of what is the rigors of study, and also the job roles of the future. The experts would tell you more about the physiotherapy as a program and also give you what needs to be done to become a successful physiotherapist. Let me set the context by indicating that this is one of the noble professions and respected and recognized all over the globe, including India. Of late, physiotherapists are being regarded as part of every process in the healthcare sector, and they play a significant role. And if you look at the opportunities for physiotherapists will be much higher than what we have seen in the past. They are required all over the globe, handling all kinds of diseases and particularly the prevention of diseases. Physiotherapy is a healthcare profession. Officers say it takes care of the rehabilitation part of it, the prevention part of it, and the fitness part of it. The treatment is always by using physical methods of therapy. Physiotherapists are the rehabilitation professionals and normally registered with the Rehabilitation Council of India. And pure physiotherapy may not be the requirement or may not be the need of the hour going forward. Possibly we have seen the role of physiotherapists in the recent IPL matches that we have seen, the cricket matches where for every discomfort a player would encounter, the physiotherapist will always be there to help that player out. Probably you've seen the role of a physiotherapist. Within few minutes, few seconds, the player is back to the full fitness and continue playing, because the role played by physiotherapists is phenomenal. Let's look at the important things, aspects that you need to consider before joining the BPT program, the Bachelor of Physiotherapy. Or the experts will tell you what you're going to study, how it's going to be. What you need to understand is physiotherapy program. What are the job opportunities upon graduation? Second, what are the important skills that you need to have to become a successful physiotherapist so that you will have a profession which are of highest repute? Your job opportunities are going to be plenty. You can define a role for yourself based on the talent that you're going to acquire, the talent that you already have, and the kind of skills required in the future. The job in the future requires many skills, including communication skill. Therefore, because you need to communicate with the patient, you need to communicate with the party who is taking the physiotherapy. And the physiotherapist needs to have the ability to make an assessment and analyze. Quick analysis is very, very important. Therefore, physiotherapy is also involved in various areas. As I mentioned, it's a normal individual doing a normal kind of thing, sports, several. Therefore, you need to decide what's the area of your interest. What's a passionate area? Where exactly you would like to work? Then you also need to make an assessment what kind of the person you are, so which suits that the speculation that you're going to select, because each one of them requires a different set of mindset, different set of personality to be successful. And you also need to understand what the rigors of study. Rigors of study means apart from what is being done in the classroom, you also need to have lots of practice sessions, which are also being given in the course, but you need to make a little bit of extra study to understand each of these things in a lot more detail than the normal. Therefore, you need to do something apart from physiotherapy. What do I mean by that? By that I mean you need to get some knowledge, let's say electronics. electronics or physiotherapy will help you to come up with some instrumentation for measurement. Because after physiotherapy, you also need to measure what is the efficacy of the physiotherapy that you have done. Therefore, you need to have an instrument to measure it. To devise or design that instrument, you need to know a little bit of electronics. Instead of having another electronic specialist working with you, it's better if you learn a little bit of electronics along with physiotherapy. Therefore, then you understand things much better. I'm sure in the future, there will be a lot of the legal issues that may also come in the process of treatment. Therefore, if you know a little bit of law, apart from physiotherapy, it's better. Therefore, law and physiotherapy is a combination which you can think of. Not necessarily everybody needs to have it. Apart from physiotherapy, if you also have the law background, I think is much better to handle things. The law, physiotherapy along with the psychology, probably maybe a course in physiotherapy, but psychology, understanding the person's mindset or other things is the other area where you can specialize. And you can also think of music as a part of your physiotherapy, as a therapy itself. Probably if you understand music and physiotherapy, I think that's another area where you can have a minor in music and a major in physiotherapy. I think there are lots of things, options that are going to be available in the future. The other thing that you can also think is neuroscience and physiotherapy is another combination which you can look at. There are many. Possibly a computer science and physiotherapy is another thing which you can look at. By using the computer science background and physiotherapy background, you'll be able to contribute significantly to teach the people or come up with a series of audio and video kind of lectures for people to follow. So you'll be doing a great service to the humanity, great service to the society. I'm sure the experts would tell you more about this going forward. And the last thing that you need to know is you decide to do a physiotherapy, you know there are lots of opportunities, and which university to do that. I think you need to join a university which has understood these kinds of requirements of the future, like a combination of music and physiotherapy, a combination of maybe law and physiotherapy. That university which can provide you an option like this is the university you need to choose. In other words, the multidisciplinary learning becomes a necessity of the future, is needed for the future, because almost all the things in the future are multidisciplinary in nature. Therefore, a university which provides you that kind of a thing is the one which you need to look at. Then you also need to look at a university which gives you the right kind of ambience to learn. And Dayanand University is one university which has a medical school. Possibly the physiotherapy program is being run, is being offered along the side of medical college. Thereby, you get a lot more exposure compared to a pure physiotherapy college. Therefore, you get a lot more opportunities to learn. You get an opportunity to interact with the experts, the medical experts, doctors. Therefore, I see Dayanand University is a university which gives you all the kind of ingredients that are required. And Dayanand is one university which is ready to experiment, which is ready to try out many things, so that the students who graduate out of this program are well equipped to face the challenges in the future. I'm sure at the end of this webinar, you would get a complete information which makes you to take an informed choice of doing a program of physiotherapy and a university of your choice. With these few words, I thank the organizers. I thank the participants for their patient hearing, and wish each one of you best of luck. Thank you. Thank you very much.
Thank you so much, sir. Thank you for setting the context and giving your ideas and thoughts to the students. With this, I would like to take the opportunity of inviting the Dean, Dr. Pushpa Sarkar, and she'll be touching upon the topic physiotherapy and its role in healthcare profession. Over to you, ma'am.
Good morning to all. Honorable Vice Chancellor, the Principal, Dr. Vijay Kumar, our guest speaker, alumni, and all the participants. A very good morning to all of you. Now, as Mr. Shinde was mentioning, all of you have completed your second PU, some of you preparing for the NEET exam, CET, and so on and so forth. Then what is a big question mark? Now, all of you are in the science stream. You've taken up your PCMB with a purpose. So some of you may already have a focus or a goal, like, I want to do this course, I want to be something. But as you know, each profession or each course has a limited number of seats, and maybe you don't know, you want to become a doctor, maybe you will not be eligible to score a particular ranking for you to get into a medical institution. You want to become an engineer, you want to do your BSc, life sciences or allied health sciences, physiotherapy, and so on and so forth. You have a big question mark, what to do next, right? So with this, again, most of you have shown interest because this webinar was on physiotherapy. So most of you have shown interest to look into, to learn or to look into what physiotherapy has to offer and what is physiotherapy, to know something about this particular course. So we shall take you along to let you know what physiotherapy offers, what you're going to study in physiotherapy, what is physiotherapy, and after physiotherapy, what. All these will be answered in this particular session. We'll take you through the session here. And as you know, all of you are aware of the healthcare industry, which has been rapidly growing nowadays. I mean, across the globe, everywhere, because you're being asked to wear a mask, you're being asked to sanitize your hand, asked to be clean, take fresh air, breathing exercises, and so on and so forth. Now, this is because of the pandemic, but even then, most of them are looking into the healthcare industry. Now, yet, what do you think? When you say health and care, you think of, okay, doctors, you have nurses, and what else? So even now, even in India also, the healthcare industry is growing rapidly, but we're not unable to meet the needs of the population. There's not only because of shortage of doctors, there's shortage of all the others, all the other, and medically you have all the other participants in this healthcare industry, the healthcare givers, healthcare providers, all of them they're asking for. Now, there is a shortage. They're not able to meet the needs. So what is required now? The required is that to increase the provision of these healthcare professionals into the society. So we at Dayanand Sagar University, we are at a mission to provide the healthcare providers into the society. Shinda, can I have my share screen?
Yeah, no, it's already given.
It's given? So at Dayanand Sagar University of College of Physiotherapy, now we do, as Honorable Vice Chancellor was mentioning, we are a university which houses the healthcare, including the medical, the nursing, the physiotherapy, the allied health sciences, and pharmaceutical sciences, and also the engineering, and we have management, we have law, and so on and so forth. You name it, we have it under the university. So this will give you a whole picture. It is not only any stream is not restricted to one particular field. It's multidisciplinary, as Sir was mentioning. So I was telling about this, not able to shift this.
You can go down, ma'am, to the presentation mode, and I think it will be playing.
Yes. Now, let me tell you what physiotherapy is. Now, when you see this physiotherapy, now it's put up here that physiotherapy is considered as one of the most promising medical fields. Now we say medical as well as physical training. That means to say you detect and also you treat the problems. So here you see, when you come to nursing, we say that the nurses, they follow the instructions of the doctors. Whereas here in physiotherapy, now you act as doctors here by yourselves, because you also detect the problems for the patients when they walk in. Some of these patients may be sent by doctors, which following an operation, following a surgery, or following some orthopedic procedure, the doctors would not be able to attend everything by themselves. They can prescribe, they can treat, they can give medicines, they can operate. Followed by that, it needs a different type of treatment, that which is done by the physiotherapist. You also can treat the patient directly. You can detect the problem and you can treat the patients. So why do we say it helps in making positive changes to health and lifestyle of the people? Now, when we say this, what do we mean? Many patients come there with chronic pain. They may have a frozen shoulder, so they're not able to perform their normal functions because of various reasons. You may have a fall, you may have a muscle tear, you may have something so that you may not be, your shoulder may not be performing well, so you have restricted movements and painful movements. So what happens? So you go to a physiotherapist, so they prescribe certain exercises and also they'll tell you how to strengthen the muscles around it and things like that. They treat the particular cause. Therefore, your lifestyle changes. You have free movement. So this is done by a physiotherapist. So why we say it offers opportunity for a challenging, rewarding, and satisfying career. Why do we say this? See, you have seen so many celebrities in the sports field. For example, in tennis, time and then, if you can say Nadal, you can say Djokovic, all of them are having chronic, injuries. Time and again after a match, they're suffering injuries. But by the next match or a particular lull of season, they again come back. They come back, they challenge, they win Grand Slam. There are so many sportsmen like this, not only sportsmen, even the general public also, they come with different problems, with restricted movements or various problems, pain here, pain there, and things like that. Therefore, what happens for physiotherapists, each patient is different, each subject is different. So it's a challenging career. And once you treat them and they get rid of this particular pain, or they're able to move again, they're able to perform well, they're able to win awards. So that is rewarding for you also. It's a rewarding. See, I treated this particular person, and now he is able to move about. Now he's regained his actions. So it's rewarding for you. And it's satisfying also. So in general, if we say scientifically, when we go about totally, we can say that physiotherapy belongs to a branch of allied health sciences. So the functioning of neuromuscular, skeletal, and all the other systems. It's not only earlier, it was musculoskeletal. Only the pain, the joints, the muscles was treated. It's not so. In COVID cases also, if you see, post-COVID also, people had difficulty in breathing. They had fibrosis of the lungs, definitely there are a lot of post-COVID complications. So the physiotherapists could treat that also. The cardiopulmonary part of it also could be treated by the physiotherapist. In fact, in our own hospital, it was done. Many of them came out of this particular problem, this respiratory problem. They couldn't breathe properly, and things like that. So what do you do in a physiotherapy? When a patient comes to you, you examine the patient, you diagnose, you find out what the problem is, the treatment. So you treat, and also you give them advice, how to go about, how to keep the movement, how you should perform the exercises, and all those things. And instructions, if you have movement dysfunction, they give instructions up to what level you can keep moving, how to increase the movement, and all these things, body malfunction, physical disorder, disability, recovery from neurological diseases. There may be so many neurological diseases you may come across. There may be atrophy of the muscles, you can have this following diabetes also, you can have neuralgia, diabetic neuropathy, and so on and so forth. And post-surgery also, there will be restricted movement in many of these cases. So how to come back to a normal lifestyle, all of this will be done by a physiotherapist. So what do you say? A physiotherapist assists the people either to maintain, to increase, or to reinstate their physical strength, function, and also the mobility. Just imagine you're not able to move. You have a spine surgery. You have a fall. You have an accident. You're bedridden for nearly 4 or 5 months. Then you need to function back. You need to mobilize yourself. It's a real pain to be like that in such a long duration. So here, it is here where the physiotherapist helps you to regain your normal functions. So after that, if you are bothered about career, now I've done this physiotherapy, fine, I'm getting into this physiotherapy. Now this looks very encouraging. I'm equivalent to a medical doctor. I'm relieving people of their pain. I'm making them function normally. I'm making person who is bedridden, I'm helping him to walk back. So all this is fine. Then next what? What are the other things? What else? Where could I be placed? See, you take anything in the health industry, there is no recession in health. There's no recession. The jobs are not taken away from people. They're not removed from the jobs because, there are less jobs. It doesn't happen in the health industry. Populations are increasing, diseases are increasing, all this disabilities are increasing. So, and there is awareness in the people. Most important is awareness in the people who want good health. So all of them are looking towards the health industry. So there's no looking back for want of placements. In this case, if you see in physiotherapy, you could be in educational institutions and in universities where you teach and also treat the patients too. If you're attached to a medical college like ours, you have patients coming in who are referred to you. Also patients directly coming in also. In health institutions, orthopedic clinics, you can work alongside an orthopedician. Rehabilitation centers. Even here you play a very, very important role in rehabilitation centers. Sports training facilities, as our Honorable Vice Chancellor was mentioning, you see most of these, when you see big stars, that's where you see in the, in your TV, television, or wherever it is, when you see of big stars, they always move from countries to countries along with the physio, not even with other people. Even the managers travel separately. Always the stars have their physiotherapists along with them, and no sports team is complete without a physiotherapist in that particular team. So you have fitness, you can ask them, you can also work as personal fitness consultants. Even in, in multinational companies, they would want you to come there to attend to this personal fitness of their employees. So you can be a consultant to many of these. Then high performance sports centers, schools also. You can have these physically disabled children. There are special schools where you can go, help them out, and bring the smile on the children's faces when they get back. And able to get to the next slide. Okay. Now, in continuation of that, now, why do you want to get into physiotherapy? Now, other than these career opportunities, you also have many more. You can work in hospitals, you can work in nursing homes, fitness centers, in the gyms. In the gym also, you can be a physio there. And in the defense, you can get into the army, which is very, very important. The defense, whether it may be army or air force or navy, wherever in the defense, you can get into the defense and serve there also. And you can be an advisor also. And you have this physiotherapy equipments, that manufacturers, you can work with them. You can give an idea of what is required. You can get to the R&D department, research and development department, where you can research and make more devices to help these people. A special device which helps. So suppose somebody is having diabetic neuropathy, they're not able to walk, they're not able to sense. So you can come out with a special device. Along with the engineering department, you can use where an app is developed, which can be then, a device, an innovation. A device can come out of it. So such things you can get into the R&D, research and development department also. You can work with equipment manufacturers, in corporate houses, as I was telling you, and healthcare centers, and you have your own private clinic also, not a problem. So now, ultimately, we're asking, why do you want to get into physiotherapy? So why do you want to get into physiotherapy? Now, to state, we have 1, 2, 3, 4, 5. Now you must have understood what is the importance of physiotherapy. Now you have a variety of work opportunities. As I was mentioning now, all these opportunities you have a variety of work opportunities where you can get into this. Then every day you have a new challenge. Each case is not the same. It's not a routine thing. You go, you do this, this is my work, you do this and finish it off. It's not so. Every day you see a new person, new patient, new challenge, how to go about it. Okay. And as I was telling you, you have a reward is worth the effort. Now you put in so much of effort to treat the patient. Definitely it's so rewarding when you make them walk, you make them, you're bringing a smile to their faces, relieving them of their discomfort. So it's very rewarding. And you have a diverse web of colleagues here also. You don't work by yourself. You work with orthopedicians, you work with pulmonologists, you work with cardiologists, you work with various doctors, you work with NGOs, you work with so many people. So your colleagues will be diverse with so many different faculties you work with, and you have a promising job prospects, as I was mentioning to you. So quickly, I would take a small tour. When you enter the first year, you learn the medical subjects about your body, what is how is your body, the anatomy of your body, the disposition of the various organs. That's what you learn in anatomy, the functioning of the body in your physiotherapy. The physiology, how these organs function and put together. In the biochemistry, you learn about the cellular level and so on and so forth. You learn about various. And here we have this, the medical college, Chandrama Dayanand Sagar Institute of Medical Education and Research, we call it as CDSIMER. You will be trained, the first year you'll be trained in this particular institute along with the medical students. Okay, the same training is given to you as medical students. The same teachers will be teaching you. The same infrastructure is given to you. The same exposure is given to you. And you have a fantastic environment at Dayanand Sagar University, at the College of Physiotherapy, where you learn alongside the doctors. And this is the academic block, what you see. And this is the hospital block, where you have a variety of patients coming in. So you have exposure, first-hand exposure with the patients. It's not that you learn just by observing, it is hands-on experience you have with the patients. And this is the anatomy dissection hall. You can see how beautiful it is, how large it is, where you see the dead body dissection and the parts of the body. And has been taught to you, you have a museum, the dissected parts are kept here. You can look into each one of you, where every single muscle and every single bone of your body is taught here, shown to you. It is all natural ones which are dissected and kept here. Nothing of that is a synthetic one. So here you have the physiology laboratory, where you do all these blood tests and all the other experiments of measuring the blood pressure and basic things, looking into the ECG and all those things. Then this is the clinical physiology laboratory, the biochemistry lab, where you do the blood tests, urine samples, and various fluids. This is another view of biochemistry laboratory. This is a microbiology lab, where the culture sensitivity and all the virology and all the other experiments are done here. In fact, your COVID test is also done in this particular laboratory. Then you have the radiology department, where also you need to be exposed to how, because you look into, you also need to learn how to, look into the x-rays and see where is the deformity, where is the defect. So you need to learn all this. And this is the ultrasound. And here is the ICU. So some of the, as I was telling you, certain cardiopulmonary patients, you need to go see the patients here, also help them in their movements, in their breathing capacities and other movements too. And this is a dialysis center of us, the post-op ward, and this is the operation theater. Now, particularly in the orthopedic, when there's an surgery going on, you're also letting to observe how this is going on. So at first hand, you see what's being done. And there's an OT complex we have, the demo rooms. There's a lecture hall, and there's a library. So there's another part of the journal section of the library, and the library part of it, there's a digital library where you're allowed to use the digital platform here and surf your internet. And there's a gym facility available there, and there's a hostel blocks and the bus facilities which is given. So there's a tour of what we are taking. And at Dayananda Sagar University, we see to that when you people come in, we see to that we train you in such a way. It is not only the curriculum part of it. We have all the extracurricular activities also being taken care of here, encouraged for your overall growth, overall development. And when you leave this particular institution, you will be a trained, skilled, and a confident physiotherapist to take on the world. Thank you so much.
Thank you so much, ma'am. You can stop the screen sharing and I'll take it over. So here we are, students. We'll move to the next session. I'd like to invite Professor Dr. M. Vijay Kumar, sir. And sir will be talking about the physiotherapy program at DSU and its merits. Over to you, sir.
Thank you, sir. With permission from Honorable Vice Chancellor, Dean Dr. Pushpa Sarkar, and with the team of admissions who are there in the process of career building for the young and aspirant students who are looking down for shaping the careers in various grounds of medical educations. And that was a fantastic presentation from Dr. Pushpa Sarkar, taking a complete detour of our DSU Medical College and the facilities and the way that they are going to gain the knowledge, the confidence, and the skills when they take admissions in DSU. DSU is one of the premier institutions of the state of Karnataka and of course the state of this country, trying to provide the best of all the facilities it can do in terms of education, in terms of infrastructure, in terms of career building, in terms of your psychological support, and what not to be said. It's a apt place for somebody to come and make his or her life to the best that he or she could do. Thank you for the small introduction, sir. And with your permission, I would like to make a small presentation so that people can understand why take physiotherapy in DSU. With the permission, sir, please.
Please go ahead.
Yes, sir. Hope my screen is visible.
Not yet, sir.
All right. Just a second, please.
Go to the screen sharing and then have the.
Yeah. Hope it's available now, sir.
Yes, sir.
All right. Just a second.
And go to the, done, sir.
Yes, sir. So, as I said, as ma'am has rightly pointed out in the beginning, we are a family of DSU with almost 7 and 8 major schools in DSU. College of Physiotherapy is a part of the health sciences fraternity, which is shared along with pharmacy and nursing. So we physiotherapy become an independent identity who are into a training of patients who require post or pre-operative at various levels. So we have fantastically being governed by the administrations of DSU under the guidance of the officers and authorities of DSU. Okay, which is being properly being guided, supported by our Dean, Dr. Pushpa Sarkar. So say about what our College of Physiotherapy is. We are quite old, started in 2004 under Raju HS, but College of Physiotherapy came into Dayananda Sagar University as an individual entity in 2015 with 40 intake. As it started growing up with more amount of demands and requires for the society, we increased the seat for BPT to 60 and MPT to 10. And now the demand is so increasingly high, and we are looking down for better catering. And due to the amount of experienced staff work sharing the knowledge to all the students, the demands has made us to take up the next level of taking the seats to 120 for BPT and 30 for MPT. And we also started PhD program. That's the highest degree that as of now is available in any education institutions. with a vast experienced faculty available on the boards and various disciplines from sports to musculoskeletal sciences or orthopedics, or who are dealing with bone and joints, or who are dealing with neurological patients of brain and other problems, who are dealing with heart, lung, other problems, who are dealing with women's health, who are dealing with community problem. So we have a wide variety of experienced staff members who to take care of this students who are coming down here for physiotherapy in our institutions. In short, the programs offered of BPT, which has got 120 intake, and this course is a 4 years full-time course with 6 months of internship, which indicates that 4 years you will be involved in teaching and learning process, gaining experiences, gaining hands-on skills, gaining confidence, shaping yourself, and the 6 months of internship will be given for you so that you can put all your skills that you gained in the last 4 years into a complete training process so that you become individually equipped to meet the demand of the society as a individual quality healthcare professional. Not stopping it over here, our master's degree program has got 30 intakes as of now, which is a 2-year full-time program offering 5 electives as of now, wherein the electives are more related to orthopedics and sports. As in the previous presentation has been discussed about the role of as physiotherapists go down to for sports management and in sports teams. We are having a fantastic infrastructure. We have got fantastic faculty for this. Neurosciences of patients who are dealing with problems with brain, spinal cord, who have got difficulty in standing, walking, or moving, whatever it is. We also work on have a specialty called as cardiopulmonary rehabilitation, which is focused on diseases related to hearts and lungs. And this department has extensively worked to the maximum it could during the COVID-19 situations, where our department has ensured that people who are at the deathbeds are also being taken out to be back to their normal living with a quality lifestyle. So this is fantastic work, and the community-based rehabilitation is extensively working on improving the community life of the individual into the community. And we have women's health and OBG. That's one of the kind which is found to be said, like, because in Karnataka, this institution, the first one to start a branch called as OBG and women's health in physiotherapy, and followed by as many institutions did start. And adding to the feather, the hats, we have started a full-time PhD program, and it is from the year 2022. What are the unique features of our College of Physiotherapy? We are bold and we could boast it out that our medical college, that is CD Saima Chandramadayan Sagar Institute of Medical Education and Research, is the biggest asset for students who are aspiring to take physiotherapy in this institution. It is an asset, I would say, because any medical college is what it's going to cater the best for a healthcare profession. And Physiotherapy College has got a fantastic link, has got a fantastic relationship, and has got a fantastic utilization of all the facilities of infrastructure, faculty, and all the available departments for a better learning process. You've got a state-of-the-art infrastructure campus with all in availability. You can name anything. You got a canteen, you got a play area, you got a ground, you got a gym. Whatever a student needs to have in a student's life is available on this campus. And we're the first to start MPT, as I said, in women's health in Karnataka. And we don't teach only on classrooms. We make the students, make you people go down to learn what actually is happening in the community, what is the need, what is essential, and how to engage yourself into community for a better community healthcare programs, because we are all focused on inclusive of social responsibility as a corporate. How do we engage you? Apart from regular teaching that usually any institution does it, we engage you with multiple components. For example, we have got almost 5 MOUs with other institutions and tie-ups, and we got almost 7 tie-ups with various institutions and hospitals and grounds, wherein the students can take an opportunity to go ahead and learn through integrations. And if somebody is learning only on a small area, or a small group, or probably in a small institution, or maybe in a circular limitations, maybe your knowledge is limited. We open up avenues for the students, wherein a student can go to multiple institutions, multiple organizations, multiple areas of field or sport, wherever it is, so that you can improve your skills, improve your confidence, improve your communication skills and whatnot, so that you can become a well-equipped and confident physical therapist at the end of the 4.5 years of course. We are more leaning towards community integrations, extension activities, and to be very, very, very proud to say, like, We have at least 2 or 3 activities taking place every month, inviting eminent professionals across the state, across India, wherein they have been invited through CMEs and seminars and workshops so that your skills can still be enhanced and increased. That's what we're looking for. And we have a regular problem-based learning and journal clubs. We focus on research as one of the most important component of your teaching learning process. This is a few clinical attachments that we have apart from our own hospital OPDs, apart from our hospitals. DSC group has got 2 hospitals for its own and a medical college. Apart from that, we do have attachments and types with the other hospitals, wherein you as a student who is aspiring or taking a foot in DSU College of Physiotherapy will be given an opportunity to experience at various dimensions. What is the strength? Because you should know when anybody comes down to institution looking for what I'm going to gain and how I'm going to be trained. DSU College of Physiotherapy is a multidisciplinary institution. I would say that's one of the big advantage, because an institution of health sciences is as one important component. As we are in health sciences professionals, we also have multi-centered components. We have physiotherapy, we have nursing, we have biotechnology, we have management, we have engineering, we have life sciences, we have journalism. What not institutions we have, or we can say we have it over here, and there's always a good collaboration taking place between all these departments so that the student can learn journalism, learn communication, learn technology, learn management skills, learn collaboration of engineering, as Vice Chancellor has rightly pointed it out, how we will be able to collaborate in engineering with the physiotherapy, how can we collaborate journalism with physical therapy, or nursing and pharmacy physical therapy. So this everything is under one umbrella called as DSU, Dayanand Sagar University. So this institution has got a fantastic capability of giving opportunity for you to be engaged at various dimensions. We have undergraduate program, we have a postgraduate program, also a PhD program as a pioneer institutions. And what not a student has, you come inside for BPT and go out with a PhD degree in your hand after almost 7 years of study or 8 years of study. And of course, what else you wanted to have, as you are going to have an opportunity to achieve the highest degree in education. CDCMR Hospital is a 1,500 bedded hospital. 1,500 bedded hospital. It's the best you can have for an area where you can explore your skills and learn the maximum, the best you could do it up with all high and efficient and great surgeons and teachers available over there in all the departments. And we have MOUs at multiple institutions, and we also have or in the process of making international collaborations for student and faculty exchange programs. And what will a student need if it is being supported or guided for collaborations with international institutions. Our teaching is not only on blackboard teachings, not only on clinical teachings. We do believe on your, the updations and upgradations of systems of educations, the ICT based learning. We use effectively the information and communication technology for teaching and learning process so that our students are abreast and updated with all the process of teaching learning process. We have a beautiful and strong ecosystem for innovation and entrepreneurship, a separate department for research, so that your ideologies of your treating or learning, whatever it is, can be converted to research process, and the department of research can take care of it well. And everything, every activity of the university or the institution is being properly governed by the internal quality assurance cell. So this, in short, this institution is being well framed, well designed, well executed with proper system of execution for a student who comes down and learns. And this is what the institution can give the best to any student who aspires to come down to College of Physiotherapy. So this College of Physiotherapy is a well-organized institution. Coming to a curriculum, our syllabus is in par with international standards, giving you almost 6,000 hours, which is more than the requirement for anybody who's aspiring to go abroad, either for education or for placements. We will focus on practice-based learning. We are always focused on skills, because it's not a theory, it's a skill, because physiotherapy is going to be a completely hands-on skill. So it's a skill-based training, and we focus on research. So we have got both minor and major subjects in all the years with 6 months internship, ensuring that the student is being given the opportunity to learn the major subjects for improving the individual skill, and also the minor subjects for improving the individual's personality. This, in short, you can find a well-developed and a well-organized system of curriculum that is being framed for your year 1, or year 2, or a year 3, and also year 4 with the proper internship program. And a well-designed program, a well-designed curriculum is what is essential for a student, which gives a proper guidelines for him or her to learn without any hassles during the process of the study course of 4.5 years. Campus. Look at this picture. Fantastic and beautiful. All-inclusive campus. And a student can have the best campus life available. What not you wanted? A student coming down to institution should have a life and should be lively in the campus. And this institution gives you the lively atmosphere. You can have a chance. You have a campus that you can eat whatever you could do it up in the canteens. Play whenever you're given the permission for. Study with all facilities available with libraries and institution libraries. Experience by interpersonal relationship with all the departments could been put together, and naturally you grow with confidence. That's what the campus is. Classrooms, well ventilated, huge, can accommodate everybody, with ICT is always enabled with internet facilities and LCD projectors, and upgrading even to touch screens on other monitors. The labs, well equipped, well spacious. Every student will be given opportunity for improving his or her technical skill and hands-on skill with a spacious laboratory of the kinesiology lab for the first years, and for the electrotherapy lab in the second year. And more labs are found to be there in the process of renovations and in the areas of neurological lab, cardiorespiratory labs, orthopedic lab, or sports lab. Name any lab that is required for a complete and confident development student is available with us. The exercise therapy lab is secret over here. Any program that requires a mass gathering for a complete teaching learning process by external faculty, we have a fantastically designed seminar hall, completely acoustic in nature, with completely ICT facility enabled, and the experience of being in a seminar hall is always great enough, which is absolutely, you can say, you don't find it in any other institutions. We don't look only in terms of academics. We look on for a complete learning of an individual through extension activities, academic enhancement programs like workshops and seminars. And our faculties are also regularly being updated with the faculty updated programs. And we don't stop only in educations. We also encourage sports and cultural activities at least twice in a year. This is a few of the glimpses, I would say, about what a College of Physiotherapy is actively involved into what. We recently completed it. In the last 7 months, I completed this couple of workshops. One of them is a BCLS workshop that tells you about a complete teaching and learning process for the faculty and students. Equipped, this is for equipping for going to the communities. Activities extension related to blood donation camps. We have released a new magazine called as the Physio Works that tells us about what we are doing in the last, every 6 months is being updated and given to the student and the public so that we'll know what we are doing and what we are planning to do. Taking up World Environment Day or WHO days seriously and trying to involve into environment building into green campuses. We also involve students and faculty for Freshers Day and other days inclusive of your cultural activities. Regular CMAs is being done in institutions. And we invite celebrities. Recently, we invited Mr. Shane Shetty, Big Boss, as a gift for us for annual cultural gatherings. We have an ethnic day being celebrated. So there are so many things that this institution is offering you, ensuring that this campus life is lively, it's always vibrant, it is also always enthusiastic, keeping yourself on the move, keeping the faculty on the move, ensuring that you, when you step into DSU, you will definitely find that you have stepped yourself into one of the best institutions in the country for educations of physiotherapy and also for holistic development. In short, I would say physiotherapy in DSU is you are in a best in class institution in the infrastructure. You have a highly qualified faculty with a lot of experiences. You're studying with a medical college facility available in terms of teaching, learning, patients, and your faculty is available over there. Advanced lab equipments. It's an all-inclusive campus. You will be planned and trained for a holistic development, and education is always with ethical principles. We don't deviate, or we train an individual as an ethical practitioner. We also support you and guide you for careers through a career support and guidance cells. And we assure you of an excellent campus life. And of course, at the end of the day, you will receive a high quality professional training. So welcome to DSU, and we are eager to meet you in this College of Physiotherapy. The faculty and staff are always there to support you for all the needs and demands and requests you keep in for us. So thank you for your patience, time and listening. And thank you for all the officials who has given the opportunity for the presentations. Thank you, sir.
Thank you so much, sir. A wonderful presentation giving all the glimpse of the School of Physiotherapy in terms of programs, labs, campus lives, overall holistic development of the student. Thank you so much.
Thank you, sir.
I now would like to take the opportunity of inviting our guest speaker for the day, Dr. Moana Krishnan. And as said, he's a senior physiotherapist, has been with Jawaharlal Institute of Postgraduate Medical Education and Research for more than 25 years. He's done his master's degree in physiotherapy in 2009 and has been a top ranker, and has done his certification in orthopedics and manual physics therapy, his compact diploma in yogic education and PhD in 2016. Sir is going to talk about the physiotherapy as a profession, its uniqueness, scope, and future. Over to you, sir.
Yes, sir. Thank you. Thanks for the introduction.
You can do the screen sharing in case.
Yeah, you have. I'm not able to start it because you have to initiate it, I believe. It says
yes,
oh,
sir. Ali, immediately give the screen sharing rights.
Yes.
So you can look at the green button below, screen share.
Sir, I don't have a presentation. I just need to switch on my video.
Sir, that also will go on the screen sharing.
Yeah, done.
Yes.
Yeah, I'm in. Yeah, good morning, everybody. Hope you can see me. I'm audible.
Yes.
Am I audible?
Yes, sir.
Yeah. Good morning, one and all. It's so nice to meet you all, and thanks for the opportunity. Thanks for DSU, Dayanand Sagar University, the principal, the vice chancellor, and the dean, and the respected people. Good morning, one and all. Again, here I'm supposed to speak about the profession, its present status, its past and future. Yeah, you can see my gray hair. I've been here for nearly more than 2 decades. So we have crossed 2 generations. Not really generation, but 2 decades. They're quite long, and you see that you have crossed a mile and more. And when you see that, you have seen the growth of the profession as such. First of all, let me talk about the profession. Physiotherapy is a profession where it has got its own identity in treating patients in physical means. Physical means, I mean by means of exercises and electrotherapy modalities. So the uniqueness of this profession is that you treat a patient to bring back their normalcy by means of physical aids. And the main modes of treatment is going to be your physical approach using your hands. They are your main tools, and you observe, understand the patient status, their mind, the body status, and you try to work them from within. When you see this profession a few decades back, maybe some 20, 30 years back, it was in a bit of a dormant stage where the profession was slowly evolving by itself. Like initially, the course started with a certificate course, and later it went on for a diploma course, where you have a more of a. Hope my voice is loud enough. Yes, is it okay? My voice. Okay. So what it was used to be like, it was more of a practical hands-on experience. Like a therapist used to attend the rounds and follow whatever the orders which was being given by the orthopedic surgeon or the neurosurgeon regarding the patient's prognosis is concerned. So it was a more practical oriented where you tend to do what the surgeon prefers and the patient feels. So you didn't have any structured plan or anything of that sort, which was lacking a little bit of a curriculum and theoretical basis of framework. From there on, our profession was slowly evolving itself, where a graduate degree was formed in 90s, if I'm right, late 85 to 90s, where we started having a graduate program. In physiotherapy, we started having a proper structured things like, for example, you have the basic of anatomy, physiology, psychology, and the basics of all the other medical specialities, from which we started building up our professional theoretical framework of work. And that kickstarted our professional framework with appropriate ethics and things like that. So having said that, we started building our framework of I should say, like professional practice, and slowly this bachelor degree evolved into a postgraduate program where specialization of orthopedics and neurology was the prime network, along with cardiorespiratory. Having all these three specialties in place, and things started evolving gradually, and our people started giving high quality treatment and patient care services, where our services were recognized to the highest level. For example, cardiac rehabilitation. You cannot just imagine cardiac rehabilitation can play such a critical role, a life-saving role. It is not that you get operated and you're back on your on the ward, where you are lying down, not able to move around, not able to do the previous activities which you have been doing. What is the purpose of you getting operated or getting treated if you're not able to get back to your normalcy? So that's where the role of a physiotherapist comes. He evaluates skillfully, sees your limitations, sees your capacity, and just tries to rehabilitate you and tries to put back to you safely. So the job of the surgeon or the physician stops giving you the treatment, but the therapist role starts to put you back to the normalcy, to re-establish your earlier work setup and to deliver the best. That's what you need actually at the end of the day. And as you see, this bachelor degree blossom to masters, and from masters, slowly people started pursuing PhD programs. That's where the professional standards grew up to the skyrocketed. And by the time we had post-graduation programs coming up in other areas like geriatrics, women's care, women's health, pediatrics, pediatric neurology, sports physiotherapy, and things like that. So having said that, you started having a wonderful proliferation of specialization, which you started giving high quality programs, and so thereby you started giving high quality care. Just for an example, you see nowadays physiotherapists doesn't or don't stop themselves from pain care. They are everywhere. For example, in a pain clinic, that's where the physiotherapy started. Like they treat you for pain relief. You have some electrotherapy modalities, so which you treat along with a physician or an orthopedic surgeon. Your role doesn't stop there. That was a primitive status of therapy standards. From there, you started getting into orthopedic setup. Then slowly it started going into cardiorespiratory, neurology, pediatric neurology, cardiology, pulmonology. Pulmonology is one area where physio plays a very critical role in rehabilitation, believe me. Having said that, we don't stop there. Our role was well identified in the field of geriatrics. Geriatrics is a potent source where you need physiotherapy for every possible thing. And the buck doesn't stop here. You have the wonderful field of psychiatry. That's something very interesting. Nowadays, the role of physiotherapist in psychiatry is being proved beyond doubt. The role of therapist is well recognized in psychiatry as well. And when it comes to geriatrics and women's health, the role of therapist is felt at most. But it all depends on the therapist delivery status, its ethical standards, its professional professional level of patient care services. So having said that, you need to educate yourself, keep up your communication skills on high level, and treat from your heart, because you don't have any medium other than your hand and your eyes. So you make a thorough evaluation of the individual. You see them, you listen to them, observe, understand the limitations, understand the difficulty of the patient, and go ahead and treat the patients. Not just 1 or 2 days, but on a continuum. For example, you take the case of stroke. You start treating at a subacute or an acute phase, and you go on to stage like, for example, you keep treating them till for a period of not less than 1 year. So rehabilitation can be a short term, a long term, sometimes in continuum. For example, in the case of Parkinsonism, as I previously mentioned, geriatrics is a place where you have a high scope of practice, and the scope of practice is extended to the extent that it is for the life. Parkinsonism, schizophrenia, all these patients need physical activity and form structured exercise program, and our neurology physiotherapists have achieved miles, and they have successfully imparted a structured program. But what we need to do now is standardization of physical therapy approaches. That's where a good and a quality education program has to offer you. So you need to have a good professional ethics with high standards of scope of practice, and to standardize exercise therapy protocols for every possible condition you come across, whether it is geriatrics or pediatrics or women's health or sports. You try to standardize your program there, which you establish your own identity. So this is the stage where we are in to deliver the standard of education, what we have acquired from our institution, and to deliver to the society and gain the familiarity and the importance from the common public. That's where we stand now. So physiotherapist has to educate himself, have a heart in evaluation, in application, with kindness. And physiotherapy uniqueness is that it is a part of a mind-body medicine. Nowadays, the much is being spoken about mindfulness, yoga therapy, and all these things. So physiotherapy is a medicine, is a form of a medicine which goes to the mind directly in the form of exercises, which keeps you well and sound and healthy and finally happy. So the physiotherapist role is very important in the sense that this profession will improve the individual's quality of life and not just the quantity. So when you see a physician or a surgeon operating or treating a patient to cure a disease, therapist takes care from that point to take him to the normalcy, to bring back the quality of life, the quality in the life. So having said that, therapists play a very important role in medical care, both as a team and as an individual. That's where the autonomy comes, the part of autonomic practice of physiotherapy is concerned. So it is not just stops with a team, but also autonomic. You can have a clinic for yourself and run it successfully with proper legislation, and you try to execute a good quality health care. So you have a teamwork in place, a community care in place, a clinical practice in full autonomy. So that is the uniqueness of physiotherapy when compared to the rest of the profession. So it is as good as any other medical profession, which can gain good reputation to you, to your family, and to your society, and finally to your country. So youngsters, educate yourself and be proud to be a physio. Put forth your society, your family, your country forward, and looking forward to meet a good bunch full of good physiotherapy students every year from every part of the country. Jai Hind. Thank you.
Thank you. Thank you so much, sir. Thank you for giving a wonderful insight on the physiotherapy as a profession, its uniqueness, scope, and future. Thank you so much for your time. I would now like to invite, it's always good to have your alumni, your passed out students who are available to talk about their experience sharing, the life at DSU, the campus experience. So we are here, I'd like to invite our student who has passed out in the 2022 batch, Mr. Abdullah. We are happy to have you here for this particular session.
Hi, everyone.
And we would want you to give your experience sharing with our prospective students. Over to you, sir.
Hi, everyone. My name is Abdullah Yahya Abdullah. I'm from Nigeria. I'm an alumni of the Ananda Sagar University. It gives me a mass pleasure in sharing my journey for the past 4.5 years in the Ananda Sagar University. The 4.5 years journey,
Go ahead, sir.
Am I audible?
Yes, very much.
Yeah. The 4.5 year journey I had in DSU was tremendous, and it builds confidence in me, and it develops discipline along with the studies as well. I learn, I love, and experience the most beautiful aspect in DSU, which I will cherish in the lifelong. The Ananda Sagar University is a kind of, has a lot of personality, which can be like shared in the world. The teaching, the clinical aspect, the exposure, and the teachings and learning, and as well as the standards of the teachers, and the faculties also are approachable in terms of needs when the student arises. And lastly, I would like to thank the principal, DSU, and the entire management of the university that give me this ample opportunity to express my opinion regarding my college. Thank you, thank you, thank you.
Yeah, thank you so much, Mr. Abdullah. It's a wonderful opportunity to have our students always coming and talking about their experience with the aspiring students. So here we are, students. If you have any more queries, you can please put it in the Q&A box. And till the time we have the experts on this particular platform, we should be able to help you out with the answers to those specific queries. However, in the interest of the students and the kind of demand that we have at Dayanand Sagar University with respect to the physiotherapy program, we have limited seats, and based on the eligibility, it is offered on the first come first, purely on the merit basis. I would want all of you to visit dsu.edu.in, go through the entire program that is being offered under the School of Physiotherapy. You have any questions, please log on. You can always call us at 080-4646-1800. We will be happy to look forward to resolving all the queries that you have. You can visit along with your parents. You can also make a visit to our campus, see the entire facility, see the hospital, and then you will be able to understand the strengths that are available today in looking at being a part of the DSU family and having a program done which has got right associated with hospitals. And let me tell you, it's not just the CD Seimer. We also have the Sagar hospitals that are associated with us under the same brand, in which students can look at a lot of internship activities along with the program. So with this, we come to an end for the today's webinar. I would like to thank all our distinguished speakers, our Honorable Vice Chancellor, our Honorable Dean, We look at our Professor Dr. M. Vijay Kumar, who's the principal of the College of Physiotherapy, our industry guest, Dr. Moana Krishnan, and of course, our alumni student, Mr. Abdullah. Thank you so much for your time and to come in and to give your experience sharing with the students. This definitely gives a lot of inputs to the students who have got certain kind of queries in their minds and are not able to take a constructive decision. With this kind of inputs, I'm sure it will allow them today with an open mind to look at giving a shot for the career in physiotherapy. With this, we'd like to say a big thank you to all of you. Stay safe. Any questions, you are most welcome to log on to our website and call us, and we'll be happy to solve. Thank you. Thank you so much.
Thank you, sir.
Thank you.
Thank you, Mr. Shinde.
Thank you, ma'am. Thank you so much for your time.
Thank you, everyone.
Dr. Vijay Kumar
Thank
and
you,
Dr.
Abdullah.
And Dr. Moana Krishnan, thank you so much, sir, for joining us.
Thank you, ma'am.